Thank you for tuning in to watch our Invest Dallas Fort Worth Launch Conference. You're about to watch panel number 2, Closing the Gap, how education and healthcare can work together to close the talent gap. Enjoy.
All right. Should we move on with the second panel? The first panel was fascinating. Thank you for all those amazing insights. And obviously, I always think it's something successful where it generates a lot of discussions. But I am equally, if not even more excited about this panel because with growth, there are also a lot of challenges. And one of those challenges is around our workforce. And this morning, we're going to focus on closing the gap on our healthcare workforce. And the only way that I think we can effectively do that is through partnerships. As Mayor Ross said, it's through relationships and to be able to move upstream. And to me, closing the gap is twofold. Not only have we've been on a journey of a challenging path of the healthcare workforce for a while, but the pandemic certainly has accelerated that significantly. And as we look at North Texas in particular, that challenge is both from the growth that we're experiencing and to be able to keep up with the workforce that's required to provide healthcare for our community, but also addressing the disparities that we have and how do we elevate and bring everybody into that workforce and the opportunity that presents. So I am so excited that we've been able to bring together just an amazing panel that represents both higher education, public schools, the healthcare provider community, and the payer community. So to start off, do you mind saying hello and introduce yourself and brief your organization? And Dean Wiley, we'll start with you.
Thank you, Steve. Good morning. I'm Marilyn Wiley. I'm Dean at the G. Grant Ryan College of Business at the University of North Texas. UNT, founded in 1890, is the third largest university in Texas, and we're the largest college within that university with almost 9,500 students. Happy to be here today. Good morning. I'm Rose Johnson. I am the Administrative Director of Academic Partnerships for Medical City Healthcare. Medical City Healthcare is comprised of 20 acute care facilities across North Texas and 7 emergency departments. And in my role, I work with our educational partners and academic partners to ensure that we have a robust pipeline of caregivers. And also, I'd like to acknowledge Mayor Ross because he does sit on the Board of Trustees for Medical City Arlington. So wanted to publicly thank you for your service in that. And I'm delighted to be here as well.
Good morning, everyone. I'm Dr. Donnell Waters, Area Superintendent for Idea Public Schools, in which my portfolio encompasses 32 schools across Texas, Louisiana, and in Florida. And I also would like to say a word to Mayor Ross. I'm from Philadelphia and I'm an Eagles fan. So your keynote this morning really stung a nerve with me. So I wanted to make sure I let everybody in the house know that before the panel began. But no, thank you, Mayor Ross, for all the work you're doing, and just excited to be.
Hi, my name is Rogers Wilson. I'm the National Medical Director for Behavioral Health at Evernorth. And Evernorth is a Cigna company for health services. So we really focus on pharmacy, data analytics, research, and care management. So really happy to be with you today. By profession, I am an adult and forensic psychiatrist. So I don't have insurance information, so don't worry about this.
Well, as you can tell just from the backgrounds and the roles, this is just an amazing panel. Maybe to start to make this real before we get into a whole set of questions, because what we all agree that the collaboration, the partnership between education and healthcare is really what's going to really drive this and change moving forward. Maybe each of you provide an example on how have you, from your organization, partner with the counterpart on the other sector, just as again as an example to make this real. So, Dr. Wiley, maybe we'll start with you.
Thank you.
I really feel like I should have a guitar to be sitting up here, but I'm not.
And boots and hats.
Yeah, yeah. Um, we really do think about this as a partnership. And as a business school in particular, we directly partner not only with external organizations, but internally. So for example, we try to focus on the business side of healthcare through degrees. We offer an MBA for students in the pharmacy program at the Health Science Center, and also for students in the physical therapy program, because healthcare has to be managed as a business to be successful. And beyond that partnership, there's another partner that I would like to see us bringing forward in that, and that is the human side of healthcare delivery. I would love to see a more active partnership in those kinds of partnerships, bringing in the social sciences to think about the individual needs of the person to whom we're delivering the healthcare.
Wonderful. Thank you. Rose?
Absolutely. So I'll talk later in the discussion about some of our pipeline opportunities, but broadly, what we've really tried to do is make sure that we have really good relationships, because I do think that that's important with our academic partners. One of those relationships consists of making sure that healthcare organizations have a seat at the table in academic advisory boards, because that's opportunity for healthcare organizations to discuss future trends and then also weigh into curriculum development. And we've really tried to do that at Medical City Healthcare. Beyond that, we like to partner with our educational partners to make sure that we're creating really good pathways for our employees, because we recognize that some of the areas in healthcare with the largest turnover are in those entry-level positions. And so it's incumbent upon us as healthcare organizations to make sure that we provide really good career pathways. We like to see people with healthcare careers thrive. And there is enough within healthcare that we should be able to, along with our educational partners, help them navigate that career pathway.
Rose, that is such an important point, because I think we often in the community as a large think about healthcare as the doctors, the nurses, the techs, but it takes a city literally to run a hospital. So there's so many diverse roles within healthcare that can be and should be filled in training such a critical portion of that. So thank you for the comment. Dr. Waters?
Yes, the partnership between the school and the healthcare sector is extremely important. I'll come from this question here from two angles. First and foremost, within IDEA, we have a campus in the Austin area that is actually called IDEA Health Professionals, in which they really focus on preparing students for the healthcare sector. On the horizon, there are two things within my portfolio which we're trying to build a stronger partnership with our healthcare community. In our Tarrant County region, locally with us here, that region is still growing. And as of right now, we have up to 10th grade. Next year will be 11th, and the year after will be 12th grade. And we've already started a partnership with Tarrant Community College for a dual enrollment program for one of our campuses, IDEA ESCRIP. But one of the great visions for our new executive director, Mr. Ryan Townsend, is to have a dual enrollment program for all of the campuses within Tarrant County. And we will have those opportunities to really bring in our healthcare partners to be able to help them. And then one of our campuses that is in discussion to open up in about 2 years in Tampa, Florida, we actually have a partnership that we're building with the University of Southern Florida, in which that campus will be a full-blown health profession focused campus, in which the students will be able to take classes at USF as well. So that partnership is extremely important in being able to establish and maintain those relationships to have a good workforce to come after graduation is extremely key.
Fantastic. Dr. Wilson?
I really just want to pick up what you were talking about, the collaboration between healthcare providers, insurance companies, and educational institutions. It's extremely important. I'm thinking about a lot of the work we did coming out of the pandemic related to vitality, loneliness, provider burnout, educators burnout was really supported by educational institutions. The research, the depth of knowledge came from our academic institutions. And that collaboration is essential, especially when we think about 20% of healthcare outcomes actually associated with the medical procedure. The other 80% is based on social determinants of health. A lot of that rich research is actually coming out of academic centers. We incorporate academic learnings into medical practice to improve outcome. And this collaboration is really important as we look at people coming into healthcare as providers to really do what we can to support their transition. I was noticing in this market, there are about 15 STEM programs in the summer looking at math and science to really educate the workforce to be. There are also relationships in this market with pre-professional groups. These are doctors who actually work with kids in high school or coming into college to really promote their interest in healthcare. The collaboration is key and it is significant, but it's all about relationships.
Great point. And something that you said, I want to just emphasize is that when we think about our health, the health of the community, it does not start in our hospitals or even in our clinics. It really starts where people live, learn, work, pray. So as we incorporate these different aspects into healthcare, we need to think much more broadly than what was historically thought about. Maybe pivot a little bit and pick up from the earlier panel, because it's hard to talk about the future workforce without thinking a little bit about technology. So I would love to get each of your perspective, because this intersection between education and healthcare is so multifaceted. And we know that technology has and will continue to play such a critical role. So this question is twofold. When you look back, what technology do you feel has made such an impact to date? And when you look forward, what are you most excited about from a technology analytical perspective? And Dr. Rice, not to put you on the spot the first time, maybe we'll start with Rose on this question.
Put me on the spot first. Okay, so I think that especially the pandemic, of course, forced us in healthcare to truly leverage technology more than ever. And a lot of that still continues, and we've grown a lot. So I think one of the most important things that came out of that is our use of each one of our caregivers in our facilities carries a mobile device that gives them access to real-time data to really be able to make decisions. We've leveraged that technology before the pandemic, but even more now. And also, I think the use of virtual reality and high fidelity simulation as we're training caregivers, we've truly leveraged that technology more, and they're able to learn in a realistic but simulated and safe environment. For the future, on the AI front, I do think that there will be a lot coming. Currently, we are using AI to look at the assessments at where our caregivers are and what their needs are, and then to be able to really individualize their learning. And in the hospitals, we're using some AI technology to schedule, to look at where the competencies of the caregivers are and make a schedule based on competency, so we can make sure, because as you might know, after the pandemic, we had quite a bit of turnovers. A lot of people left healthcare. So we have a lot of new caregivers at the bedside. And we want to make sure that when they are scheduled, that the level of competency is even, that we don't have all new people on one shift. And so we're utilizing AI technology for that as well. And that has been a game changer for us. And I see that as the future for everyone moving forward.
Oh, fantastic. Dr. Vargas?
Technology is an area in which I really believe the K-12 sector of education can really improve and better educate ourselves. I remember teaching my students with the overhead projector. I remember overhead projectors. I thought I had it going on when I had the overhead projector, especially as the math teacher. But times have changed, but the education for the K-12 sector has not changed along with it at the same pace. And unfortunately, I speak to more educators that are afraid of some of the new technology advancements that are taking place. And we have to do a better job of educating students with those. They look at AI as, well, we don't want the students to use Chat GPT or something because they're plagiarizing an entire passage of work. So we're looking at the negative side and not being able to see what are some of the benefits that we can get from AI. What are some of the benefits we can get from virtual reality? What are some of the benefits we can get from our cell phone? You'll be surprised how many teachers don't want cell phones in their classes, but the students want to bring them in anyway. So we have to do a much better job in that K-12 sector of being able to leverage, being able to educate ourselves, being able to make and take those technologies that are improving several industries within our global society right now, and see how we can bring that into the classroom to better prepare our students to not only be citizens within the community, but also global citizens, so that when they graduate, they would have an opportunity to be well versed in those areas and then have a true opportunity.
I love that concept of, and I think it applies in at the bedside too, is how do we actually not focus on how we keep technology out, but how we actually invite it in, but guide it so it's being used responsibly. I was thinking, we said, before we had cell phones, now we download apps. X number of years in the future, I think our kids are going to be looking at used to download apps. They're going to be creating their own apps. So I think the sort of the pace of innovation is completely changes, just not only how we use technology, but what are some of those foundational things that we need to educate to be able to make.
And they surely don't know what an overhead projector is.
Some don't even know what a newspaper is.
Right? That's true.
Yeah. Dr. Wilson?
I would just add, technology really helped us during the pandemic. Looking at expansion of digital care, virtual care. One great thing from the pandemic, if we can think of anything, was the expansion of people seeking behavioral health services that didn't in the past. And because we opened up and expanded virtual care, it really helped us get to some of that stigma, which prevents people from accessing behavioral health care. So that aspect of technology has been positive. When we think about AI, looking at predictive modeling, generative models, I think we have used it to improve diagnostic capabilities. And what I mean by that, how do we look at conditions before they're potentially diagnosed? Looking at early data to determine this child is at risk for autism. How do we support those parents before the final diagnosis is actually made? So we really have focused on the diagnostic risk. Is a person at risk for an eating disorder? Or is there someone with a cardiovascular disorder that's at risk for a behavioral health condition? So there are a lot of positive aspects to AI, but to repeat, we really have to be careful as we go down this new road to make sure we're using good data and non-biased data. If we have biased data, we're going to get biased outcomes. And I think it's up to each of us in our organizations to put ethical structures around how we use AI. There are a lot of benefits, but there's also risks.
Absolutely. And I'll add something from my background with this experience, because it's every aspect of the journey of an individual through the workforce is not only the early education and then the continuing education, the onboarding, but also the retention. And one of the things that we've seen in healthcare at the bedside, and it's been expressed in the pandemic, is violence towards healthcare providers. And it's something that Rosie mentioned, that it's actually driving even veterans away from healthcare, to where technology can be used. One of the predictive models that we built, and it's being deployed right now at Heartland, is a model to predict the likelihood of a patient or a family doing that encounter escalates towards a violent event. So then the appropriate, not only proactive education, but the appropriate staff and awareness can be created to alleviate some of that. So there's so many different aspects of it when we think about the workforce and the training and the retention, how technology can be used effectively. Um, absolutely.
Just checking. I would echo what my fellow panelists have said, and that is the digitization of everything is really the evolution that we see ahead of us, but we are drowning in data. And as Dr. Wilson says, there's good data and there's bad data. So where I see the opportunity for us and where education comes into this as well, and particularly in the healthcare field, is the smart use of data. Data visualization, for example. So you're not just seeing numbers, but you're seeing visual impact of what you saw. And particularly the longer term thinking in the use of data. If we look at patient care records, for example, more and more your doctor is giving you something to sign into that has all of your test work, it's digitized, but the systems don't talk to each other and the systems tend to change. You go back to your doctor and they say, oh, we have a new record system, you need to enter everything again. Long-term thinking into that, we can make better sense of what we see. Putting integration across different systems gives us an opportunity to better use the information that we have. And long-term data collection, particularly if you think about patient trials, post-drug approval. Data collection and analysis can give us much more insight, I think, than what we currently see in shorter term data collection. So that's where some.
Wonderful. And maybe we'll, we'll stick with you because healthcare is a business as well, a big business. And you are educating the future healthcare business leaders. What do you focus on to prepare them for the future healthcare? And what do you see some of those intersections with the right partnerships?
Partnerships are critical, and it starts with how you bring people into those professional fields, as has been mentioned. I love what Lionel was saying about their specialized education where students can get hands-on learning. But what I don't think we do a good job of is telling students about the breadth of opportunity in those spaces. So Chris Clark on the previous panel was mentioning nobody wants to major in accounting anymore. And that's something we experience as well. But I think that's because we don't show students at an early age, before they've locked in on where they want to go, the many, many different things you can do in the accounting space. And healthcare is the same way. If you don't want to be a doctor or a nurse, you can go into X-ray analysis and build a great model that reads data better than a human radiologist might, for example. There's many opportunities, and we have to show those to people early on, and it takes partnerships to do it. Students being able to do job shadowing, having mentors from different areas within a field. I think if they can do those things in middle school and in high school, then they're much more likely to be open to that rather than locking in on something that they saw a parent do or an uncle do in a field that's changed dramatically since they first saw it.
Fantastic. Dr. Wilson, I'm going to come to you and then I'm going to ask others to comment as well, because you brought this up a couple of times, the mental behavioral health. And I think that's the current pandemic that we're experiencing both at the bedside and in the classroom. So I'm curious from your perspective first, how are health insurance companies collaborating with educational organizations and with hospitals to really foster better understanding and the proactive upstream management of mental behavioral health?
I think there's a lot of opportunity. One thing I've noticed over the years is how do we do mental health awareness within higher education, within lower education? How do we actually say it's okay to have an emotional condition? How do we think about suicide prevention? And doing partnerships, and I've had universities to do this, to partner, to really start a suicide prevention campaign, bringing faculty in, bringing students at the college level and advocate for anti-suicide types of events within the school system. One thing has been successful also is how do we think about first aid? Now, if we have start to have chest pain, a lot of us are familiar with basic CPR, but how do we look at that on the behavioral health side? Now we have mental health first aid, which is a best practice of helping people to identify someone in crisis and connecting that person with resources. So it's not about that person becoming a mental health trained provider. It's about really intervening with someone who's deteriorating and being able to pick up on those deterioration signs and seek help. And that has been very successful. But I think as we look at academic institutions, thinking about 80% of college students in health reporting, they're overwhelmed. 30% of K through 12, they're actually reporting my mental health is not good. We have opportunities here to look at new strategies within educational institutions, bring EAP in, and start talking about the stress on the population, how can we intervene? And this engagement, this collaboration, very important, not only, from an educational standpoint, but also from a health standpoint. We really have to break down walls and think of ways to collaborate.
Great points. And I encourage everybody, this is not just on healthcare and education. Think about this for each of your organizations, each of your employees as well. Any other comments from the group on this topic?
I will add for the mental health piece. Post the COVID, the spotlight when it comes to student mental health has increased drastically in the K-12 sector. I remember when I first started out as a principal in Dallas ISD, and the focus on mental health was nowhere near where it is right now, even though we still have students that have mental health issues and concerns. And the spotlight that we have on it now is so severe to the point where 2 years ago, I applied for a grant in the amount of $500,000, and I wanted to focus on 2 areas. Staff retention, because it's hard to find teachers and keep teachers nowadays, but then also student mental health, because I was able to see the need for it within the Tarrant County region, and why it was so important, because not only are we having a focus in the K-12 sector on student mental health, but also teachers and staff mental health as well. The focus is on children, but we have staff members that are also struggling with the same things that students are struggling with. So what are we going to do as a sector to be able to combat and support them? Parties.
Wonderful. I am getting the signal, so I'm going to ask one last question, and it's a 30-second response from each of you. We talked about collaboration between education and healthcare, but this of leaders here today represents so many other sectors that are crucial in this journey. What would be your one ask of the broader community and leaders across the industry, or how we can help as it relates to the topic for this morning from your perspective?
We just received a $1 million grant from the National Science Foundation to build an innovation in infrastructure and engine in the Dallas-Fort Worth area. And what that is a huge partnership to create innovative solutions, particularly in the space of supply chain and other areas. It takes partners. Join us. Let us know that you want to work with us. Together, we come up with much stronger ideas than we do on our.
Wonderful. Rose?
And you mentioned that healthcare is such a broad spectrum. There's so many opportunities within healthcare. So yeah, supply chain is one that I hadn't thought of it, but it absolutely keeps the wheels turning. So again, I just really think that our collaboration with all of our with all of our educational partners to building that pipeline to make sure that we have not just caregivers for the patients, but accountants and everyone else that it does take to run a healthcare organization.
Artists, besides the obvious of money, I would say mentorship and exposure would be serving as a mentor and giving them exposure to different opportunities that are out there that some of the children may not even begin to be able to fathom at their young age is something that's really needed. So we really need mentors. We really need students to get exposed to their parents.
So crucial. Thank you. Ms. Wilson, you have the last word.
I would just challenge everyone here to really start to think about stigma around behavioral health in your workplace. Try to focus on initiatives that allow people to talk about what they experience. And this is extremely important. If anyone is struggling with a behavioral health crisis, make sure you call the text 988. But it's going to be up to all of us to get through the behavioral health pandemic. Thank you.
Thank you all so much. Thank you.